Today is a Retta day for me. I'm currently dosing every 5 days. I started off the first 2 weeks every 7 days, but then my body adjusted. Currently at 4 milligrams every 5 days. I'm entering week 10. I feel like I've picked up a lot of knowledge. I am no expert by any means, but I have been taking peptides for 5 years, and I've just picked up a lot of things along the way that I'm just sharing because I get a lot of questions. So first thing, I used to keep my peptides in this container in the fridge, in the door. The problem with that is this is clear, so they are being exposed to light, which you want to avoid. And then the door is always moving. And with the peptides, you want to avoid as much movement as possible. It compromises the structure and the quality of the peptide. That's why they say do not shake them. I bought this case. I bought it on Amazon. It was $12 or something. Keep this just in the fridge, not in the door where it always moves, so it's always still. Zero exposure to light. Keep your peptides in here in the fridge, not in the door where it's always moving. Can you see that? Backwater. So I use Arrow. You never want to shake the vial. You want to take the vial between your hands and you want to roll it, and slowly. I've seen people oh yeah, just roll it, don't shake it, roll it, but it's that is the same thing as doing this. It's fast. You want to roll it slow roll. This is going to keep intact the integrity of the structure of the peptide. So slow roll, please. It's a subcutaneous injection, so it's literally going right under the skin. So it's not an intramuscular type of injection. The common injection sites are side of your belly button, either side, underneath your belly button, on the side here, you can I grab this sometimes to do my growth at nighttime. The tricep here, I hold a good amount of fat here in my back of my arms, so I will shoot here sometimes. And then also you can do your top of your glute as well. There's lots of different options, and I would say I used to only inject kind of here-ish. And actually, from doing this for many, many years, I have a lot of scar tissue here, so it kind of hurts now. Because if you do it too much in the same spot, you will get you're poking yourself. You're gonna get a little scar tissue. It's not anything serious, it's fine. But to avoid that, I wish I would have known, you will change injection sites. So sometimes I do here, sometimes I do this side, sometimes I do this side, this tricep, that top of my glute, this top of my glute. If I were you, I would switch. Rubbing alcohol, and usually just clean the top, pull whatever your dose is. Like I said, my current dose is 4, and you just gotta be patient. It's not something you're gonna draw super fast. It's just gonna take a little bit of time. Okay, so I gotta reconstitute another vial. So by the way, I use Arrow. Link is in my bio, super high quality, good shit. So you don't have to do this. This is what I do when I'm reconstituting. I like a bigger syringe and a bigger needle to reconstitute than the insulin syringe. I feel like it's just a little bit easier. Clean the top of your backwater because these don't have a lid, so it's good to clean it every time you reconstitute something. So this is my favorite. It's a significantly bigger needle to reconstitute. We're gonna pull 1 because the Retta is 10. Boom, and look, it's gonna go in there pretty much by itself. People are on the fence about this. I'm fine putting a little bit of air in it. I know people are against this, I guess, but I do it. Do whatever the spirit compels you to do. I put a little bit of air, and like I said earlier, slowly roll. Do not shake, don't roll fast. It's gonna keep the full quality and integrity of the potency. I'm gonna finish drawing. I only need to draw 1 more. This is already at 3. Perfect. Now I am gonna do my side because like I said, I've been doing my belly button for some time. So this is kind of what I do. I'll just find I have some little fat here hanging on. So find a little area where I have more fat. Let me see. That's fine. And you put the needle all the way in. People ask me, but yeah, can you see that? You probably can't see that. I put the needle all the way in, and then boom, it's done. And there's no blood or anything like that. Like I said, it's a very small, thin needle. It's a very short needle. I always put the cap back on the needle when I'm throwing the needle away. I just feel like that's safer. For the most part, I feel like that's everything. I would say like consistency with when you take your peptides is good. So whenever you're doing that, whether it's like at nighttime, every other day, every morning, whatever, it's just good to like be consistent with whatever time and day that you're choosing. What else? I guess that's it for now. If you have any questions, ask.